Vanakkam. Welcome to the e-content. The e-content is for the course Health and Healthcare System, MSW 5421. I am Rohini, teaching social work in the Department of Social Work, the American College, Madurai. The health and healthcare system explains the health, the cause and the causal factor for health, and how the society influences the health, and how the health is taken care with a systematic approach. Here we are going to discuss about the indicators of health on mortality and morbidity. The indicators of health. Before going into the indicators of health, health is said to be a state of well-being or physical well-being, psychological well-being, mental well-being, social well-being, and spiritual well-being, and not merely the absence of disease or infirmity. This is the explanation by definition given by the World Health Organization on health. So the health can be identified or indicated by certain factors nationally and globally. Mortality, morbidity, disability rates, nutritional status, healthcare delivery, utilization of the healthcare system, indicators of social and mental health, environmental factors, socio-economic condition, health policies, quality of life, and other factors. These are all the indicators for health. In this discussion, we will be seeing about the mortality. Mortality represents the measure of health status. It is which is said to be the measurement of the death rate of a population. The mortality is of different types: crude death rate, the life expectancy, the age-specific death rate, infant mortality, child mortality, under 5 proportionate mortality, adult mortality, maternal mortality, disease-specific mortality, proportional mortality, case fatality, and years of potential life loss. So here, the crude death rate, it is said to be the number of deaths per 1,000 population per year in a community. Reducing the number of deaths in the population is the obvious goal of the healthcare system and the medicinal practices in the healthcare. The life expectancy here is another mortality indicator. At birth is the average number of years that will be lived by those born alive into a population if the current age-specific mortality rate persists. It is a good indicator of the socio-economic development in specific factors. It is adapted as a global indicator of health. The age of the age which is expected either the living the mortality indicators in the life expectancy at birth is highly influenced by the infant mortality rate, where that is high. Life expectancy at the age of 1 excludes the influence of infant mortality. Life expectancy at the age of 5 excludes the influence of child mortality. Age-specific death rates. It is the total number of deaths occurring in a specific age group of the population, either from 50 to 54, or from 30 to 35, or from 5 to 20, in a particular area for a particular period of time on specific causes of diseases or any other environmental factors, which is there evaluated with 1,000 deaths for the estimated total population of the same group of population in the same area during the same period. Infant mortality rate is said to be the death under 1 year of age in a given year to the total number of live births in the same year. It is the rate of death less than 1 year per 1,000 live births. The infant mortality rate is one of the most universally adapted indicators of health status of whole population. It indicates the socio-economic condition under which they live. It is the sensitive indicator of the availability of the healthcare system and the utilization and the effectiveness of healthcare in the aspect of perinatal conditions. The child mortality rate is another indicator related to overall health status, that is from 1 to 4 years, which is the early childhood. It is defined as the number of deaths at ages 1 to 4 years in a given year per 1,000 child in the age group at the midpoint of the year concerned. It excludes infant mortality rate. The child mortality rate due to inadequate maternal child health, the child mortality rate, the child death happens at insufficient nutrition, malnutrition, or low coverage of immunization, adverse environmental exposures, the toxic environmental factors, or other exogenous agents which toxicates the children either in respiratory aspect or circulatory aspect, which has a negative impact on their body health or other situations. The mortality indicators, the infant mortality rate is 10 times higher in least developed countries than in developed countries. The child mortality rate is 25 times higher in least developed countries than in the developed countries. This indicates the magnitude of gap and area to be improved in the health sectors. U5, under 5 proportionate mortality rate. It is the proportion of total death occurring in the under 5 age group per 1,000 live births. This reflects the infant mortality and the child mortality. The adult mortality rate is said to be the probability of dying between the age of 15 to 60 years per 1,000 population. It reflects the health gaps in working groups. The probability of dying in adulthood is greater for men than for women in almost all countries, but the variation is large. In Japan, 1 in 10 men and 1 in 20 women die in these productive age group. Maternal mortality rate is considered to be the death among the women in their reproductive stage. At this stage, the death occurs in most of the developing world. Yeah, the maternal mortality rate varies according to the country's level of socio-economic status. And the disease-specific mortality, it can be computed for specific diseases. The death which occurs due to few diseases which are said to be the death due to cancer, cardiovascular disease, accidents, diabetes, or any other diseases which has emerged as measures of specific disease problems. And the proportional mortality rate is the simplest measure of estimating the burden of disease in the community. It is the proportion of all deaths currently attributing to it. It indicates the magnitude of preventable mortality. Here, the proportional mortality for specific diseases or under 5 mortality, children mortality, or the specific age related mortality, which can be considered by the deaths of specific conditions, either disease or by years, by the total death from all causes of death in the same year or same time period into 100. And the case fatality rate, it is the measures case fatality rate. It measures the risk of person dying from certain diseases within a given time period. It measures various aspects of disease such as pathogenicity, severity of the disease, and virulence of the disease, which virus causes the particular diseases. It is calculated as number of deaths from specific disease during a specific time period divided by number of cases of the disease during the same period, usually expressed as per 100 deaths. It is used to link the mortality to morbidity. And here, the final indicator for this discussion is on years of potential life lost. It is based on the years of life lost through premature death. It is defined as one that occurs before the age to which a dying person could have expected to survive. A 30-year-old dies in road accident, could have lived 75 years, and 45 years of life are lost, which is said to be the years of potential life lost. And the mortality indicators do not reveal the burden of ill health in a community. It does, example, the mental health, it does not represent the death rate does not represent the mental illness or rheumatoid arthritis. So morbidity indicators are used to supplement the mortality data to describe the health status of a population. So morbidity is said to be the disease condition. It overlooks the subclinical conditions or inapparent, which are not physically visible. That is the hidden part of the iceberg of disease. Following morbidity rates are used for assessing ill health in the community. The incidence and the prevalence of the disease or notification rates, attendance rates at outpatient department, health centers, etc., admission, readmission, and discharge rates, duration of study in hospital, the spells of sickness, absence from the working place or from the education system. All these indicates the morbidity, that is the disease, the prevalence of disease in the particular person. The other indicators will be discussed in the further videos. Thank you. Nandri.